Welcome back. You're still watching Nile Cruise. BSSS Student Scientific Society, known as the BSSS, was established in 1978 and joined in 1988 as a full member in the International Federation of Medical Students Association Egypt, IFMSA Egypt, which is a full member of the International Federation of Medical Students Association. This year, BSSS Student Scientific Society, BSSS, will be hosting TEDMED Live 2014, BSSS Medical School at the same time. It is happening in the US. TEDMED is a global community dedicated to unlocking imagination in service of health and medicine, and TEDMED's annual gathering includes a unified stage program and innovation showcase taking place simultaneously in two co-equal host cities in Washington, D.C. and in San Francisco. This topic we joined with the president of the BSSS Student Scientific Society, the BSSS, Karim, Hebishi, and Osama, Hegazy, head of the public relations and fundraising, BSSS. Welcome to the show.
Welcome. Thank you.
Welcome, Karim and Osama.
Thank you.
And let's just have a start that over 30 years of the professional exchange and elective research exchange, the BSSS Student Scientific Society have been working in collaboration with the International Federation of Medical Students Association, the IFMSA, under the supervision of the World Health Organization, the WHO. What can you explain, please, what are the activities then of the BSSS?
As you said, Salma, the activity includes scientific exchange and research exchange electives. And we also have 4 extra committees working in a lot of fields, including in the health system, in the healthcare. Those committees are the Standing Committee on Public Health, the Standing Committee on Human Rights and Peace, the Standing Committee on Medical Education, and the Standing Committee on Reproductive Health, including AIDS. Those 4 committees are mainly focused on issues in our society that may help medical students be better physicians through being introduced to culture. Our main aim is to offer future physicians a better understanding and exposure to the global health issues. For example,
So sort of a link.
Yeah, it's a link between the medical students in Egypt and what is going on in the health system all over the world. So we don't want our physicians to be just medically oriented, just reading books about medicine, and you don't know anything about the culture. To be a better physician, you have to be oriented about your culture, because medicine is part of the culture. You are dealing with people, you're not dealing with machines. It's not like an engineer or something. So this is our main aim.
So it has been a very long time, ever since the establishment of the BSSS. If you can tell us, since 1978, and it was established, and the history of this sort of society. If you can explain more about it.
Explain more about what?
The history of the society. Since 1978, that has been a long time.
It was established in 1978, like you said. And when it started, it was only about exchange between countries, and that was the main aim of IFMSA International. It was established after the World War, and it was providing a link for medical students all over the world, because medicine have no language and have no religion, have no deal with politics or something. It's not racial. So what the idea is to introduce something that connects people again together after the old conflicts after the World War. And Egypt started to be introduced to this as IFMSA Egypt in 1969. And BSSS, as a medical school in Egypt, has joined them in 1978. And it was all about exchange, research exchange and professional exchange, scientific exchange. So after that, we started to have a capacity of members. We have a big capacity, and the exchange was not enough for our capacity. Our abilities was more than just exchange. So we started to find something to change our society, to influence what we are living in.
Yes.
So we started to make the other committees, as I said.
Interesting that you'll be hosting this year. I don't know if it's the first time or not that you'll be hosting the TEDMED Live.
Yeah.
And this is going to be happening at the same time in the United States. If you can shed some light on that.
So it's the first time in BSSS, but not the first time in Egypt. So it starts in the US from the 10th till the 12th of September.
Yes.
So we're just it's going to be here in BSSS on the 12th, because if you organize a conference for 3 days, it gets boring.
Yes.
People don't come for all
So you
these
plan to
days.
have it only
One
one
day.
day,
One
which
day
is
conference.
It's a
coinciding
one-day
with the
conference in
global,
Egypt. Yeah. We're going to air live streaming talks from the U.S., from Washington D.C. and from San Francisco. We have the live talks on the 12th, and we have on-demand talks from the 2 previous days. Besides other speakers, Egyptian speakers from.
And Osama, if you can just tell us, what are the objectives of this event that you have?
Well, TED means technology, entertainment, and design. The mission in brief, TED's mission in brief is spreading ideas. So TEDMED is spreading medical ideas. So we're looking at spreading very good ideas to enrich the healthcare system in Egypt. We already invited the Minister of Health, Dr. Adel Adawi, and hopefully his schedule, TEDMED fits into his schedule, so he might be there with us.
We also have international guests that will be attending, like international.
I don't think
doctors
we have international talks, but we are going to view international talks.
Workshops, or like
but
a workshop on that.
it's not a workshop. It's like a talk.
Okay.
You just
like a presentation.
Yeah, not a presentation. It's an interactive presentation. You just tell people an idea in an interesting way. You're not teaching them something. Just telling them your idea in a crazy way and something like that.
Yes, which is also similar to other TEDs versions.
Yeah,
Exactly.
but is it medical?
That's
That's in
it's
medicine.
yeah.
So, interesting. What you're trying to spread here is preventive, maybe ideas, or is it about medical techniques or
The
technology?
same. Everything. We opened the call for the speakers application. We received good applications. We have Dr. Mohammed Zazour. He's a neurosurgery resident at Demirdash Hospital, Ain Shams University. He is the founder of Healthy Egyptians. He is ranked by Forbes as one of the 30 most influential entrepreneurs under the age of 30 in 2014. So when I read his CV, I was amazed. It's very good.
This is beside the international speakers.
Yeah,
from
those
San
are the Egyptian speakers.
Yes.
We have also Dr. Muhammad Anwar Khalaf. He's the regional operational manager and the quality director at the Maghrabi Eye Hospitals. And he's also an instructor at the healthcare, hospital management and quality control and healthcare system in the American University in Cairo.
Interesting.
So those are the confirmed speakers till now, the confirmed Egyptian speakers.
Yes.
We're also viewing other international talks.
Yes. How are you handling the international speakers then? Are you inviting them over?
No,
Do you do like, sort of Skype conversations?
There's a TEDMED stage in San Francisco and in Washington D.C. So
it goes live.
they are having their talks over there, and we're just by live streaming we're getting it. So
Well, that's interesting. And who's attending the TEDMED Live is definitely medical students.
not necessarily. Not
That's
necessarily. But in the U.S. you pay $4,950 to attend something like that. We're getting it here. It's much cheaper here.
Yes. So even if you're not medical student,
you can be there.
want to think of attending a $450 event.
4,900.
Even if you're not interested.
It's 4,950.
4,500.
Yeah, you have the visa tickets and
And you just
everything.
do it at BSSS for free in BSSS University.
Yeah, because we're a
That's
non-profit
interesting.
organization
We're a
working on healthcare,
That's
so
interesting.
And you also have like unlocking imagination in service of health and medicine. That is one of your most interesting themes that are being tackled. How do you think can creativity, Karim, solve some of the healthcare problems in Egypt?
actually here in Egypt, creativity is our main problem. We don't have people thinking out of the box because we all the time we think that we are not like the Western, we are not like Europeans, we're not like Americans, so we can't do what they are doing. So we lack creativity here. We don't have someone who believes in himself that he can change everything, because creativity is what makes the future. For example, 15 years ago, they knew nothing about what is going on inside a cancer cell. They knew nothing about stem cells, but one man at some point had an imagination that what if we're wrong about what we know about medicine? What if we have captured what is going on inside the cell and what is going on between the chromosomes, what is going on between the contents of the cell that make cancer, that lead to cancer, and how can we treat this? So it was an idea, it was an imagination. People would say he's crazy by this time, but now we can treat a lot of cancers, a lot of diseases like this. We can use stem cells for repair of something. So it was all about imagination.
And what type of ideas, from your previous experience, ideas that are coming up with TEDMED Live, maybe youth speaking about things that was adopted and enhanced and developed further. What types of ideas in your experience would
We're looking for something feasible.
For example, this year we will have this talk live in Benha this year. There's one talk about Active Protect. It's a company in USA. It's an innovation in USA. It's about preventing injury. The health system in all the world now is going to the prevention of disease instead of treating it. So this company, it was a smart engineer, an intelligent engineer in the States, and he invented floors like this. But when you become to fall with sudden fall on it or sudden force on it, it produces an air cushion to protect you. So can you imagine how this can protect a lot of people in the future, 15 years from now?
And this is attached to medical?
Yeah,
I think it's like, it's like I mentioned, it's more on the preventive, scientific side.
Yeah.
How is it correlated?
Actually, everything is correlated to medicine. In Egypt, we have a misunderstanding of medicine. We think that medicine is only taking medication or going to the doctor to see you. This is not only medicine. All over the world now, the rule of preventive medicine is the biggest rule in medicine. Actually, physicians don't do a lot of work. The main work and the main expenses are going to prevention of disease. For example, vaccinations. This is medicine. You are giving vaccine to someone to prevent disease. So I think this is the future of medicine. We can't go all the way in Egypt waiting for like swine flu to come to Egypt to treat it, but we have to do something to prevent it, to come to Egypt. It's the future of medicine, and they are now talking about something. It's more than prevention. It's a preemptive medicine. Preemptive medicine is before the disease actually starts in your cells. Actually, if you are prone to diabetes now, you will develop diabetes 10 years or 15 years from now. So how can I prevent the diabetes you are going to have from now, 15 years before you have it? This is preemptive medicine.
It's very interesting. If we're looking maybe out a little bit out of context, but since you mentioned ideas about the preemptive techniques, let's speak about Ebola. And would it be a topic,
Is there anything that's
tough
been dealt
virus
with the epidemics that are spreading at the moment?
Actually, I don't have enough information about this, but I think people all over the world are making good work on this virus. But I don't know what we're.
But in Egypt, we still haven't reached.
We still have a problem with this. We're not ready.
Is it going to be a topic maybe?
Spread,
on TEDMED Live?
Well, if someone applies, we're ready for a talk like that.
Mm-hmm. Right. So let's move on to the activities that you're doing as the BSSS. What activities are you doing, besides what you have mentioned?
Besides what?
The activities that is done besides what you have mentioned.
The event that you're hosting.
Well, as Karim said, we have standing committees. Like, for example, the Standing Committee on Public Health. We have we do lots of campaigns for hand hygiene. We go to school children and food handlers to encourage the proper technique for hand hygiene to prevent spread of infections. We have the Safe Liver campaign, because hepatitis in Egypt is common. We have a project called Build Your Body. We go to schools, to national schools, national public schools. We encourage children over there to eat healthy food, like vegetables, fruits, drink milk, stay away from fast food. So that's the Standing Committee on Public Health. So
and you're all students from BSSS University?
Yes, we're all students from BSSS University. Yeah,
like
BSSS.
Volunteer?
That's volunteer work.
All volunteer work.
That's all volunteer work.
Interesting. So that was really nice initiative from your side, TEDMED Live. I think it's a good step forward, especially that it's hosted for the very first time in Benha specifically. And we would like to wish you the best of luck.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you, Hebishi, and thank you, Osama Hegazy. Now let's move on for the upcoming break, and we're returning back tomorrow.